Ah, hyaluronic acid filler, the hardest working substance in aesthetics. Let's talk about it. Hyaluronic acid is actually a substance that we naturally produce in our bodies. It is a hydrophilic substance, meaning it holds onto a whole bunch of water. Its ability to hold onto the water allows it to perform that plumping effect onto our skin, giving it that hydrating, moisturizing look. We also use this filler in joints. So in joints, when we inject it, it improves the cushioning effect in the synovial fluid, that's that joint fluid, giving it shock absorption, making it easier and softer on those joints. We also use hyaluronic acid to improve cellular migration for tissue repair in those connective tissue areas. Now, the history of hyaluronic acid is pretty interesting. It was discovered in 1934 by two scientists, Carl Meyer and John Palmer. Now, they initially discovered it from cow eyes that they were able to isolate it from. Then in the 1950s, the hyaluronic acid was used in medical treatments for joint lubrications in patients with arthritis and also as a vitreous fluid substitute in eye surgery. Then in the 1980s, people started playing with filler, initially using collagen filler. But collagen filler wasn't very popular because the effects were short lived and the risk of allergic reactions was high. Then in 1996, the first stabilized non animal hyaluronic acid gel was approved by the FDA for aesthetic use, Restylane. This was a game changer. It was the first biocompatible hyaluronic acid, which meant it was longer lasting and had a lower allergic reaction profile, which meant that most people were able to tolerate it quite well because of how much their hyaluronic acid was similar to the natural one that we produce. Now, these dermal fillers allow for improvement in wrinkles, improvement in that volume loss that you get over time with age naturally, and also allow for facial and body contouring. Now, since the 2000s, there have been a slew of companies coming out with various fillers that have various indications, and picking the right filler for the right patient, for the right treatment indication to achieve the right goal is very important. But what these fillers have done, they have decreased the need to go and have invasive surgery to achieve the goals that most people want to have. Don't get me wrong, there is a place for plastic surgery for some things, but there's now a place for people to enhance the way they look without needing to do that. Like, share, and subscribe. We have a lot more to talk about. Let's stay learning.